Hello everyone! Our presentation is called Sound Asleep and was created by a group of occupational therapy students from the University of Alberta. This presentation will be narrated by Carolyn McNeely and Esther Wong. This presentation is going to look at sources of sound in the environment, how to measure sound, the effects of sound on sleep, strategies for managing sound within your sleep environment, the role of occupational therapy, and the implications of sound in the healthcare system. Now, noise is everywhere. We cannot turn off our hearing, so even if you don't wake up, your brain still processes auditory stimuli in your environment. There are many sources of sound that may interrupt your sleep, including a partner or pet who snores or is tossing and turning in bed beside you, as well as family members or roommates who wake up earlier than you or stay up much later than you. TV and electronics are an increasing source of sound these days, and outside noises such as traffic and sirens, trains, birds, and airplanes can also be quite disruptive. So, how do we measure sound? Sound is measured in the unit decibel. The higher the decibel, the louder the sound will be. Sound is measured using a decibel meter. With current technology, there are now a variety of different apps that can be installed on phones or computers. Although the accuracy of using apps is not yet guaranteed, many of them are good enough to give you a rough estimate of the sound in your environment. A study has found that the app Sound Meter is the most accurate. It is available on Apple and Android devices. The World Health Organization has issued guidelines that state while sleeping, continuous noises should not exceed 30 decibels, and quick individual noises should not exceed 45 decibels. Sudden or sharp individual noises are more disruptive than continuous environmental noise. It is found in the literature that spontaneous awakenings can increase your heart rate even when the disruption is brief. Approximately 30% of individuals are exposed to noises 55 decibels or higher, which impacts their quality of sleep as well as their day-to-day function, which we will talk about in a minute. So, to get an idea of how easy it is to exceed 30 decibels, here are some examples to show how loud some common noises are. For reference, a quiet whisper is 30 decibels. Even a normal conversation can exceed the threshold of 30 decibels. Therefore, it is important to be aware that activities such as vacuuming, blow drying your hair, or talking can impact the sleep of others around you.
Sleep disruption can have immediate and long-term functional impacts. When sound disrupts your sleep, it can immediately cause a multitude of biological responses within your body, as shown on this slide. Overall, these factors trigger a stress response in your body, and it fragments your sleep, leading to a shallower, less restful sleep. If you are constantly having disrupted sleep, it can impact your daily life and occupations. Mood, cognition, and productivity are all affected by poor sleep quality. Experiencing daytime sleepiness and tiredness affects your ability to participate in everyday activities. Studies have shown correlations with poor sleep and depressed mood, impaired immune system, attention and memory deficits, increased work absenteeism, and increased incidence of cardiovascular and coronary heart disease. There are also behavioral consequences, as disrupted sleep is associated with increased irritability and increased frequency of violent acts, including domestic violence, work accidents, and vehicle accidents. So, how does occupational therapy fit into this? Well, occupational therapists help enable individuals to engage in activities, also known as occupations. Sleep is an occupation in itself, and it also impacts every other aspect of a person's life. Therefore, improving sleep quality can improve one's ability to take care of themselves, be productive, and enjoy leisure activities. There are strategies that you are able to implement to change your environment and enable you to achieve better sleep. First, you can download an app to help you become more aware of the sound in your environment. You want to minimize auditory distractions that may wake you in the night by turning off your television and other electronics. And as we stated before, sudden sharp noises are more disruptive than consistent ambient noise. If possible, you may want to consider keeping pets out of your room. And if you sleep in a large bare room, sound may be amplified. So some strategies you can use are using thicker drapes, upholstered furniture, cushions, using a rug on wood floors to help dampen the sound. If you are unable to minimize sound, consider wearing earplugs at night to limit the sound you hear. Now, noise isn't always a bad thing when it comes to sleep, and some noises can actually assist you in sleeping. For example, listening to quiet music can help you wind down in the evening. White noise machines are also used to drown out background noises and provide a consistent, unchanging sound that can promote sleep. White noise machines are available in many different sounds, but they can also be quite expensive. Alternatives include using a fan, an MP3 player, or downloading a white noise app on your phone. Sound in sleep is becoming a huge topic within the healthcare system, as hospitals are supposed to be a place of rest and recovery. It is essential to reduce auditory levels in order to enable quality care. Currently, the average hospital environment is 42 to 55 decibels due to staff or family members talking, overhead paging, and machines running. As mentioned before, a lack of sleep can impair the immune system and may increase recovery time. As well, one study found that reducing noise levels reduced delirium symptoms and reduced the amount of sleep medication being used. So what can we do to help patients in the hospital? Quiet times need to be implemented and respected in hospitals to allow patients to rest. Doors should be allowed to be shut and not kept open, especially while the patient is sleeping. Our take-home message is that disrupted sleep can have many negative health outcomes, so it is imperative that you reduce the number of distractions during the night. However, you have the ability to reduce the noise levels in your environment to enable you to have a better sleep. This concludes our presentation. We hope you learned something new and are on your way to better sleep. Thank you.